Hi, I'm Patricia Glob. I am a childbirth educator here for Clark Memorial Health. I've been doing this for 17 years. If you are in labor, we do have spots reserved for expectant mothers because you're going to be entering the hospital through the emergency room entrance. When moms-to-be come in, they will be stopping here, and whoever's accompanying them, to have their temperature checked and screened, do the COVID-19 checklist. If mom does not think she can walk from the stored parking to the emergency room, the person with her can come to the triage desk and ask for a wheelchair, and she can come in via wheelchair. When you exit the elevators, if you look to the right, you will see the office of the lactation consultants. I want you to know where that is in case you're referred back for a weight check or for breastfeeding problem. If you look to the left, you will find the family waiting room, which is not being utilized at this time. When you get off of the elevators, you're going to go to your left, and the nurse's station will be right down the hallway on your left, and you're going to check in with your name and your birth date. This is our testing area in labor and delivery. Sometimes the doctors may order a procedure, and it would be done here in the testing area. And if they're not truly sure that you're in labor and delivery mode, they might have you come here for a couple of hours to monitor your contractions and check the baby's heart rate. Behind these doors is the C-section area. We do our own C-sections on labor and delivery. All of our personnel is cross-trained to assist with the cesarean sections. This is one of our typical labor and delivery rooms. We do have the mother's labor and deliver and recovery in the same bed in the same room. On the oak cabinet, we have the monitor, which monitors mom's contraction and the baby's heart rate simultaneously onto graph paper. The nurses do have a centralized monitor at the nurses' station so that they can view what's going on in each labor room at any given time. I know that everybody knows about the kangaroo care, skin-to-skin contact, but we do have a radiant warmer available in case there are procedures that the nurse might need to do for the baby that cannot be done on mom's chest. Behind the brown curtain, we have a nice oak cabinet that has all of the things that the doctors and nurses would need in order to do the delivery. We do have birthing balls if you opt to do that. We have the peanuts available also, and we do have mirrors so that you can watch while your baby's being born.
Now, can I lay on this anyway?
Yes, this folds out and makes a bed, which is very nice in case mom has to come in the night before for an induction or her labor's a little slow, so that you could get a nap.
Wow.
Okay, as you can tell, our bathrooms are very large. This is one of our labor and delivery rooms of the 7 that has a garden tub in it. We have a total of 2 garden tubs. They are available on a first-come, first-serve basis. So when you come in labor and you check in at the nurse's station, if you are planning on wanting the garden tub, you need to let them know at that time. The other 5 labor rooms that don't have the garden tubs do have a large shower that has a pull-down seat. You do have the handheld shower wand, and it feels really good to run the water over your tummy and your back. It's very relaxing. Not only it hitting your skin, the sound of the running water is very relaxing. This is one of our mother-baby rooms. After you recover in labor and delivery for about 2 hours, they will bring you and your infant down to one of the mother-baby rooms. We have the typical bed. We have the bassinet for the baby. We ask you that the baby be in the bassinet or crib at all times. Do not be walking around in the hall with the baby. You have a board, a welcome board that tells you who your nurse is, when you last had pain medication. It has the phone numbers for dietary if you need something additional to eat. And the hospital is providing meals for her partner or whoever might be staying with her during her hospital stay also, so that they don't have to go downstairs or try to get food brought in. After you deliver your baby in labor and delivery, there will be a footprint sheet, and there will be 4 bands with matching numbers. Mom gets 1, partner gets 1, and the baby has 2. If for any reason one of those should come off, do not throw it away. Make sure it's not in the linen. If it has come off, you need to call your mother-baby nurse because she will need to take care of that. When you leave, all of those numbers and bands must match, and one of them will be taken off and put on the footprint sheet on your discharge. Another situation as far as the baby will have a little monitor box on their ankle. Some people refer to it as a home incarceration box for a baby, but actually it is similar to that, because if the baby gets too close to an exit, it does alarm. And if that comes off, make sure that you let your mother-baby nurse know that also. Another safety protocol is do not let anybody transport your baby that does not have the Just for Kids hot air balloon on their badge. If they come in and say they're taking the baby for an x-ray or whatever, do not let them have your baby. Someone will have to come with the identifying marker on their badge to transport your baby.
If I were to come in and test positive for the coronavirus, are my baby and I separated, or do we get to stay together?
No, you are not separated. You will stay together. That's one of the things that our hospital is very adamant about, that we do not separate the mother and the baby. We do have a plan in place for mothers of babies who may not be able to be discharged with the mothers. It's called boarding. Looking forward to meeting you and your babies very soon.